Good morning, everyone. I'm Dr. Priyanka. Today we will be starting with our prosthodontic dentistry lectures. And so the first one of the lot is Principles of Tooth Preparation. Okay, so the learning objectives are as follows. So you'll have to explain the principles of tooth preparation, discuss advantage, disadvantage, indication, contraindication of PFM, summarize the recommended armamentarium for PFM crown preparation and procedure to prepare the Putty index by silicon, perform the steps of tooth preparation for porcelain fused to metal. Okay, so I will be dividing that into an anterior and posterior preparation and we'll be going through the steps. Okay, coming to the indication and contraindication, the general ones of our PFM. Okay, so these are some of the main indication and contraindications. So indications which in used where the teeth that require complete coverage and because partial coverage crowns are there, which is known as veneers, guys. So where complete coverage is required, we can use PFM. For aesthetic reasons, PFM can be used because outside layer is porcelain, inside is metal, which is not seen, and it comes into various shades. Extensive tooth destruction, which results of caries and trauma. So where there is tooth destruction or caries which was present and which had destroyed the tooth structure. So RCT treated tooth or endodontically treated tooth to provide more strength for mastication and other functions. Need the other indication is need for recontour of axial surface or correction of minor mal inclination. So yes, a little bit inclinations can be corrected by a crown, and if major orthodontics is not involved, you can do a crown and cover it up and correct it. The last one is if ceramic crowns, full ceramic crowns are not indicated, or meaning they are contraindicated. Coming to the contraindication, if there are active caries, so these cannot be done. Untreated periodontal disease, no, in unstable periodontal status, crowns, FPD is questionable, cannot be done. In young patients with large pulp chambers, high risk of pulp exposure, so of course it cannot be done. So we do something known as an intentional RCT in few cases, especially in super eruptions of teeth. So in those cases, or if you feel that the enamel is too thin or it's chipped off too much or there's too much adhesion, then you better get an intentional RCT done. So basically in those teeth, it is contraindicated without an intentional RCT. Okay. So objectives met with more conservative preparation, which is composite resin or porcelain laminate veneers. Okay, so where these can be done, um, the more conservative preparation, so there it is also indicated. Okay, coming to the advantages are high strength with good aesthetics, or less expensive than an all ceramic crown. It provides good retention. It permits easy correction of axial wall. Okay, disadvantages, yes, not very perfect, meaning, see, it has good aesthetics, but it's just not the perfect one. If you want a perfect one, you have to go for an all ceramic crown. Middle margins are visible some few times. Yeah, it can be visible, yes. Translucency is reduced, definitely, because inside there's a layer of metal and it's may discolor the porcelain. Yes, a porcelain may fracture. So these are the advantages. Okay, coming to the principles of tooth preparation, guys. So this is very important. Okay, so Schillenberg has given this principles of tooth preparation. There's a Venn diagram which is divided into biologic, mechanical, and aesthetic. So I'm just going to explain you this diagram and you can read it in detail. And coming to the biologic, so conservation of tooth structure, avoidance of over contouring, supragingival margins, harmonious occlusion, and protection against tooth fracture. So basically the biologic uh, what do you call the principle works around conservation of the soft tissue, the pulp, and all the structure. So you should conserve as much structure as you can. Do not do over reduction. Have the margin. Supragingival, yes, equigingival works better in the patient's mouth. Uh, Also, there should be an harmonious occlusion, which is it should be in opposite to the other arch you're doing. If you're doing a maxillar, you should have a proper occlusion with the mandible. There should be proper clearance. The reduction should be proper. And yes, you should not reduce too much so that you have a thin enamel layer hanging, a dentin layer hanging, and it will lead to fracture. So basically, these are the biologic principles. Coming to the mechanical principles, retention form, resistance form, and deformation. So basically, the retention is any um, it prevents the removal of restoration along the long surface of the tooth. Okay, guys, long surface. So that is the vertical. Resistance form, it prevents the dislodgement of restoration by forces in the apical or oblique direction. Okay, deformation is the whole restoration which would just dislodge due to all the other forces which are acting around it. So all these things have to be taken care of. Okay, and for these you can give some amount of taper in your preparation, so there is known as angle of convergence, divergence. Okay, you can also, so from 2 to 6 degree taper can be given. um yes, you should conserve as much surface area as possible, guys, and the wall should be parallel. Longer the teeth length equals to more the retention. So everything has to be taken care of here. In the leverage is one thing which has to be taken care of. So basically, leverage is a line of action of force which is passing through outside the supporting tooth structure. Okay, which again means um, if there's a short crown, it would dislodge. Short preparation, the length of the preparation is very important. If the preparation is long, there would be no tipping. Okay, path of insertion is important, guys. Should be parallel and should be should be parallel. Okay, there should be some structural durability. Okay, so retention should contain some bulk of material which should withstand the occlusal forces. Okay, so all these things come under mechanical preparation, guys. Okay, okay, coming to the aesthetic, so there should be a minimal display of metal, maximum thickness of porcelain occlusal surfaces, and subgingival margins. So in certain cases you have to go subgingival in the margin, which is a rare case, but yes, sometimes you do go. Usually we do prefer an equigingival, almost it's an equigingival margin, which is almost on the level of the gingiva. Okay, porcelain occlusal surface, yes, because inside there is a metal layer. Okay, maximum thickness of porcelain should be there, and there should be a minimal display of metal. Okay, guys, so this is basically the this is the aesthetic preparation, and it's like a long term. It will maintain a long term, like if you maintain, sorry, if you maintain these three principles, the tooth will have a long-term oral health, and it will give you a proper efficiency. Okay, and once you combine this is what I was talking about, so you'll get an optimal restoration. Okay, all right. Okay, coming to porcelain fused metal crowns, also known as metal ceramic crowns, consist of a ceramic layer bonded to a thin cast metal coping that fits over the tooth preparation. Okay, it combines the strength and accurate fit of a cast metal crown with the cosmetic effect of a ceramic crown. Okay, it has a greater longevity. Okay, so this is basically the introduction. Okay. Um, okay. So coming to the points to remember, since the restoration is combined, is a combination of metal and ceramic, the preparation should also be a combination. So deep reduction is needed on the facial surfaces to provide a thick layer of ceramic layer, and it can be achieved by the and it can also achieve a proper cosmetic result. Shallow preparation can be done on lingual and possible size, or guys, almost an equal preparation, which I tell you is done on all the sides. Yeah, so that's also fine. Usually, yes, we have a little bit more on the facial side, but it's fine. Coming to a wing preparation, so seen on the proximal surface of tooth preparation, when the deep reduction on the surface, or reduction on the facial surface meets with the shallow reduction of the lingual surface. So function of the wing is to provide resistance through rotation, conserve the tooth structure. Okay, so that is a wing which is present. Okay, and then consequences of inadequate reduction. So the restoration with, will be poorly contoured, adversely affecting the cosmetic results, around, on the crown, the health of the surrounding gingiva, and the surrounding teeth structures. Okay, the shade and translucency of the restoration will not match to the adjacent to natural teeth. So um, that also the shade selection is important, and it should be contoured well, and there should be a proper reduction, not under reduction. Okay, coming to a pre-preparation, that is making of putty index. So basically we make putty index for two reasons, guys. So usually we make putty index to check the reduction of the preparation. Also, we make a putty index, which is another putty index. We make it for the provisional restorations. Okay, so we will discuss that when we talk about the provisional restorations, guys. There also you make similar putty index, and you just don't cut it. Okay. So here we are making a putty index for the reason to check the reduction of the preparation. Okay. It's made from silicone putty impression material. It is possible, and it has a positive check on reduction produced by the preparation. Okay, so you mold the silicone putty on the labial and lingual surface of the tooth. Okay, and so you take two materials. You take the what do you call the putty, and you mix them, you mold them, and you put them in the axial, you press them in the labial and lingual surface of the tooth to be prepared, and a little bit of the adjacent teeth. Okay, so the index should contact the labial and the lingual surface of the tooth properly. Okay, especially the tooth prepared. Then you cut in the middle of the labial and lingual half. Okay, and you just cut it, and this is how you check the facial surface, this is how you check the palatal or the lingual surface. Okay, all right, so that's what the putty index is all about, guys. Okay, so you can do it and check it. Okay, so usually in the department we don't do it, but of course it can be done, guys. Okay, so and now coming to the anterior porcelain fused crown. Okay, armamentarium, or the materials to be used, is like a lab knife with the number 25 blade, silicone putty, an accelerator, handpiece, flat and tapered diamond burr, small wheel diamond burr, long needle diamond burr, torpedo burr, radial fissure burr, and biangle chisel. So guys, please go through and read properly the names of the burrs so you'll understand better. Steps are making the depth grooves or the orientation grooves, incisal reduction, labial reduction, lingual reduction, incisal initial proximal reduction, lingual axial reduction, axial finishing, axial and shoulder finishing. Guys, okay? So incisal grooves, the gingival and the labial grooves. Okay, so it has to be done in two planes. That's why there are two different planes the gingival half, incisal half. Okay, to achieve adequate reduction without encroaching the pulp, the facial surface is prepared into two planes. Okay, guys, here, sorry. Okay, so reduction of the facial surface, extension of gingival plane can cause the incisal edge to protrude, resulting in bad shade, match, or over contoured block. Reduction, reducing the facial surface and extension of incisal plane can cause the surface to be tapered and too close. So I have a photo to explain that. Okay, here can be an exposure, there can be too much taper, and this is too thick, so it should be almost proper. So one and two planes, guys, okay? Yeah. So you're not too close to the pulp if in case it's not RC treated, or even if it is RC treated, okay, guys? So you have to know the two angles. Okay, so we have to know the angulation of the burr. Coming to the step 2 is the incisal reduction using flat and tapered diamond burr. So it can be done first to allow easy instrument access to the axial surface and gingival, finish lines. Okay, so incisal. Now yes, you have put the grooves before, but now you try and reduce the grooves. Okay, so inadequate reduction can lead to poor translucency of the finished restorations. Okay, so flat and tapered diamond burr. Okay, coming to the labeled reduction, which is the incisal and then the gingival, guys. Okay, so using flat and tapered, again, all two structures are planed off to the depth of the orientation groove. Okay, so it's just planed off. The gingival portion, using a flat and tapered burr, what happens is, so again, you are trying to just reduce it properly, and reduction should be carried out labioproximal line angle to a point 1.0 lingual to proximal contacts. Okay, so it should, a little bit should be left because we are going to do a proximal preparation later, guys. Okay, so coming to the lingual reduction, guys, you can see the lingual reduction going on. Okay, so you can use a small wheel diamond burr, and the 0.7 clearance should be there with the opposing to the 1 clearance is there usually with the ceramic veneer, and of course it can be varied in different case to case basis, and it can be judged in a patient's mouth properly. Okay, if you feel a little more reduction is required, we can do it for sure. So it's better to have a little more than little less, guys, meaning yes, it's always better. Very slight, more or to the point is the best. So less reduction will lead to their problems in preparing the crown, and especially problems for the lab person. Okay, so while he'll be fabricating, there'll be less surface to put the two layers, okay, of crowns. So junction between the cingulum and the lingual wall should not be over reduced. Okay, so the junction between the lingual and the, so we have to keep a margin there. Okay, so it will affect the retention. Okay, so step 5 is the initial proximal reduction. So you use a long needle and you just cut through both the sides and leave a very small margin, and then you can just nick it off. You can just like cut it off with a probe. So yeah, nicking this. Okay, so this, what will this help is it will avoid it nicking the adjacent teeth, guys. Okay, so that's how you do it. It can accentuate the chamfer finishing line on the lingual and the proximal axial surfaces, guys. Okay, so you just have to put and run around. Oh, also, guys, you have to know the color coding of the burrs. Okay, the grids, the red, the blue, the green, and the yellow. So usually for the finishing we're using a yellow burr. Okay, this is a radial fissure burr to smoothen the labial surface and form a radial shoulder finish margin. Okay, all angles and edges of the preparations are rounded to facilitate seeding of the restoration. Okay, so everything is rounded, guys. Always remember, everything has to be what do you call, parallel usually, and it should be equal everywhere. The reduction should be not too thin, not too thick, and it should be perfect everywhere. Everywhere has to be smooth. There should be no sharp line or point angles. Right, so coming to a posterior porcelain fused metal. So now I'll be showing you some colored photographs and diagrams, also clinical. So armamentarium, almost the same stuff. Lab knife with 25 number blade, silicone putty. This is just to cut the putty, okay? Handpiece, flat and tapered, diamond fissure shot, needle, diamond fissure, torpedo, diamond burr, torpedo burr, radial fissure burr, chisel, okay? Steps: planar occlusal reduction. So this is basically occlusal reduction, functional bevel, cusp bevel reduction or functional cusp reduction, facial reduction, proximal axial reduction, lingual axial reduction, finishing, facial axial and shoulder finish. Okay. So the occlusal reduction should follow the configuration. Yes, exactly. And geometric inclination, right? Okay. So it should follow the cusp, the depth, and the groove. Okay, coming to our functional cusp reduction, guys. So functional cusp bevel is done by a round and tapered diamond. Okay, there. So a wide bevel is placed on the functional cusp depth grooves, which is also helpful for the reduction. So you can place depth grooves here, and then you can kind of reduce it. Okay, guys. So functional cusp bevel is an integral part of the occlusal reduction. All right, so you just do the beveling on the functional cusp, guys. Okay, you round off a little bit of that portion, not the whole thing. Okay, so only that portion, guys. All right. Okay, so failure to place a bevel can produce thin casting or poor morphology, guys. So just for that reason, we do require. Okay, coming to the occlusal clearance, guys. Yes, it can be checked by and what do you call wax wax sheet or wax block or portion. So what happens is you tell the patient to bite in between, and if it's not touching, that means there is clearance. If there's perforation or very close, it will be very thin. Okay, so it can be checked and utilized. All right. So coming to the facial reduction, guys. So buccal and lingual reductions are done with round and tapered diamond. Okay, round and tapered diamond. The size of a diamond will produce the desired axial reduction, while the tips forms the chamfer. Okay, so the tips form the margin, guys, and the sides do produce the reduction. Okay, so that's how you run it, guys. Okay, so the burr has two cutting edges, guys, one and two. Okay, and this is how it would look once you're done with one of the portion, the facial. Okay, coming to the proximal reduction, guys. So initial proximal axial reduction with short and needle diamond burr, and followed by round and tapered. So first you have to just cut through exactly same. You can see this margin, right? Just cut through and through with the needle shaper, and just break it from a probe, and then you can go around by like a round and tapered, or yeah, burr to make the margin, guys. Okay, that's how. So you can see the margin is there. Coming to lingual axial reduction. Okay, so lingual axial reduction is axial finish. So you use a round and tapered diamond burr. All axial surfaces are smoothened, including all the points. The finish line should be smooth and continuous, guys. Okay, so you can see everything should be finished and rounded off properly. Okay, guys. Okay, so This one was is the last one, that is the facial axial reduction, which is done, guys, on the yeah, by using 171 burr. Okay, all right, and of course there should be, it can be smoothened by a radial fissure burr to create the finishing line. Okay, and yeah, I think that's all, guys, right? So this can be used. Okay, so guys, always remember never to over taper the preparation, never to taper too much, um, never over reduce any of the, try not to over reduce any of the preparations. Take care of the angulation of the burr. You have to learn the control of the burr, and then you'll be able to produce a good morphology. So I always tell the people who are doing preparation that tooth preparation is exactly the same form of the big teeth. Okay, so uh, basically it's a miniature version of the actual teeth. Okay, with the same cusp grooves, line angles, point angles, everything same. Okay, so we cannot change the morphology, guys. You have to give proper um, finishing lines. Okay, and the smoothing should be done well, guys. So these things have to be remembered. Okay, all right. Okay, so I guess that's all, guys. Okay, and yes, so like this is for a bridge preparation, guys. Okay, this is die cutting, which is done. We'll talk about it later, guys. So I'm just showing you the preparation. So when I see from a bird eye view, I should be able to appreciate all the margin. I should be able to see the grooves and the cusp at least a little bit there. I don't want to see like a cavity preparation, or I don't want to see a flat occlusion, guys. It has to be a miniature version of the big teeth, okay? So you can see this. This is a bird eye view, and this is a frontal view, okay? This is a single crown, guys. This is a margin, okay? Yes, this is a functional bevel, guys. Can you see? So you'll be able to appreciate, guys, okay, on the functional cusp. All right, guys. Okay, so thank you so much for patient listening. I hope you understood the lecture. You have any questions or doubts? I'm always in Polyclinic 3 in the Prosto department. Find me around. And for tooth preparation, this is an FPD topic which comes under fixed partial dentures. You can refer to any of the two books, which is Rosen Steele. It's the name of the author, or Schillenberg. Okay, so any of the two books work really well, and they both are based on fixed partial dentures, which is FPD, and this topic comes under FPD, guys. Okay, all right, thank you.